Okay, this video are drugs a joke? So this painting here is Copernicus having a conversation with God, and the patient is by Jan Matejko. The artist is Jan Matejko, the Polish artist. So he was a Polish Catholic priest, Copernicus. Okay, and he's sort of an inversion, and what I'm going to give you is a health inversion in your understanding here. Okay, so the big question is, are drugs a joke? The average patient thinks that nutrition is a joke and that drugs are for real. Oh, I want a real treatment. I want the official treatment. Okay, the standard of care. Standard of care is usually for chumps, okay? You want optimal care, optimal treatment. So there's three main categories of drug. Number one, there's a drug that replaces something. Those are the best drugs. You know, if you have hypothyroid, replace it with thyroid hormone. If you have insulin-dependent diabetes, replace it with insulin. If you have, for some reason, a testosterone deficiency, like you had bilateral castration for some reason, okay, take testosterone, okay? If you got an estrogen deficiency, in the appropriate context, maybe take an estrogen. If you have growth hormone dwarfism, take growth hormone. If you got Parkinson's disease, take L-DOPA. So when you replace it with the body's hormones, that can be very useful. That can be, you know, essentially curative, like for hypothyroid, for example. So those are the best drugs in general. The other drugs that often are useful are antibiotics. You know, don't get me wrong, most antibiotics are prescribed unnecessarily and you don't need them and they disrupt gut flora. They're usually mitochondrial inhibitors very, very often, and they can have a lot of side effects. But I've seen people's lives were saved by antibiotics, so they can do good things too. Okay, but now let's talk about more than 99% of drugs. They're metabolic poisons. That's what a drug is. It's a metabolic poison, typically. Antihypertensive, they poison your blood pressure system. Statins, they poison your cholesterol metabolism system. Metformin, amongst other things, is also a mitochondrial inhibitor. Selective serotonin reuptake inhibitors for depression, treatment of depression. They're routinely mitochondrial inhibitors. Look at all this crap. Lots of people are on a statin and metformin and SSRI, and they're all inhibiting their mitochondria. Brilliant. It's totally stupid. Okay, processed foods full of mold inhibitors, the fungal antifungals that are mitochondrial inhibitors. There's tons of medicines that are mitochondrial inhibitors. Okay, and then here's the fundamental problem. Most disease is dietary, and you can't cure dietary disease with a pill. It's just not going to happen. Okay, so trying to poison your way to health is not a smart strategy. You know, that's not how you get. You know, if you look at the Olympic athletes, they might take testosterone, but other than that, you don't poison your way to health, and that's a replacement drug when they want to load up on anabolics. Okay, so anyways. The reason all these diseases are called chronic, like obesity, hypertension, diabetes, coronary artery disease, and autoimmune disease, is because internal medicine, conventional medicine, never cures them. Okay. On the other hand, low-fat vegan diet with no oil routinely cures these diseases, most of them, and it cures a lot of other things too. So why is it that conventional medicine is considered the standard of care when it never cures the common diseases, but low-fat vegan routinely cures them? Okay, the cure rate for coronary artery disease with low-fat vegan, Esselstyn said, for his diet, when people actually followed it, was 100%. 100%. What's the cure rate for cardiac angina with stents? 0%. What's the cure rate with cabbage, coronary artery bypass grafts, open heart surgery? 0%. Why is the something that never works the standard of care, but something that always works is virtually never done? Stupid. Okay, typical scenario is a textbook will say, no one knows what causes this disease. But fortunately, our pill can reduce symptoms. So just match the ill to the pill and send a bill. Medical students, they never learn about nutrition, diet, toxicology. They don't learn everything that starts with S, spirituality, and all that other stuff that's important too, sleep, religion, exercise. They don't really have a significant, deep understanding of it that they can communicate that effectively to patients. Okay, what else? Drugs always have side effects. What makes you healthy is God's way, that He's given to us. Basically, low-fat vegan diet with no oils. Maintain some type of social support, friendship system with your friends, your family, your lady, your man. Okay, get your sleep, get some sunshine, exercise, have a sense of purpose in your life. That makes you a lot more healthy. And a lot of times it can come from religion. Religious people are way healthier. They won't speak about that because the medical system runs on atheistic Darwinism, so it can't talk about the fact that religious people are way healthy. If you want to look that up, look up Harold Koenig and all the research on that. Okay, and you heard it in the blue zones, et cetera, et cetera. Okay, drugs are good to replace deficiency like I talked about. Most people are sick because of excess, not because of deficiency. They're always trying to sell you stuff with deficiencies. Oh, you're short on this. Buy our drug, buy our pill. That's almost all of that's BS. Okay, let's see. Here's a good quote by old Socrates. The purpose of philosophy was to determine how we ought to live. Useful knowledge helps us live a better life. In order to decide how to live well, we need to learn what is good for us and what is bad for us. Okay, so anyways, that's the point about drugs. The bottom line is most people have a dietary disease. You're not going to poison your way to health. Low-fat vegan usually works. A smart person would give that a try first for most situations. Hope that was helpful.